Good afternoon. There are a lot of Minnesotans who can see some relief coming that they've been waiting for a long time, and we are so fortunate that the market stabilization tool we put in last session is working. This time last year, Commissioner Rothman and those of us who are in public policy knew that the individual market was at risk of collapsing. And so that's why we prioritized rebates in January and reinsurance shortly thereafter. And it is the reinsurance program that is showing real impact on rates in the individual market. That's essential for Main Street, Minnesota. Our farmers, our small business owners, those are trying to start out in the entrepreneurial spirit, need to see relief in their insurance costs. And this is the beginning. We have a lot more reforms to do. All of us are watching Washington, but we're not going to wait here in Minnesota. We're going to continue to build on the good work, the bipartisan work that was done in this last session. So,
I would just say one of our priorities at the beginning of session was to make sure that Minnesotans who had been impacted by the increases in the individual market could afford to pay them. And that was one of the few promises that we talked about, along with some tax reform and transportation. We're very happy that we made good on those, and as we expected, we thought that there would be about an 18 to 20% reduction, and that's what's happened. Of course, it's not a full solution to the problem, but we're very happy with how things have gone, and we will continue to work on this problem. We want to make sure that this market is stabilized, and we're very happy with where we're at right now.
Well, thank you. It's hot out here, so I'll try to be brief. We're happy with the results of the legislation that we passed to provide some stability to the marketplace. It did exactly what we said it would do, what we promised it would do, but we knew it was still fixing a problem that was created by Democrats over the last few years that is really bad. MNsure and Obamacare have been disastrous for Minnesota families, and while this simply puts a pause or a Band-Aid on the hurt, it does not completely reverse it, and there's still a lot of work to do. So we will continue to roll up our sleeves and work on behalf of Minnesotans to try to get some more competition in the marketplace and bring rates much further down to where they're more affordable for Minnesotans. The things that Democrats promised but didn't deliver on. So the work will continue. We're happy with the results that the rates for most of the providers have actually Minnesotans will see rate reductions in their health insurance. We think that that's a very important step, but we have a long ways to go, and we need everyone to work together to fix the problem. So with that, we'll take some questions.
Democrats opposed this reform, including the governor who did not sign the bill, in part because it was so expensive. But would you address the first part? Democrats did oppose this. They didn't think it would necessarily work for the cost. But now you've got to come up with more money in the future.
Well, this isn't a permanent solution, and it's not something we ever intended to be a permanent solution. It was intended to be a stopgap to kind of stabilize the marketplace, and we hope that it has done that. There's many states where insurers have been leaving the marketplace. With this provision, every insurer has stayed in the marketplace, which we think is a good thing for Minnesotans. It'll provide some choice and hopefully some competition. You're right, the governor did not support this. In response to your question about he and Democrats being concerned about the cost, I really wish they would have been concerned about the costs that they incurred on Minnesotans. Hearing stories on the campaign trail last year about Minnesotans having to pay $3,000 out of pocket per month for a family of four with a $13,000 deductible, I don't even call that health insurance. But that's what Democrats brought Minnesotans. And while it may take time to fix, we're committed to bringing Minnesotans a solution that will work for them. If you want to.
Senator Benson, would you?
So the Commerce Department was instrumental in structuring this reinsurance bill and moving forward the waiver. So saying the governor opposed this, he didn't agree with it. It wasn't his path. But certainly there were bipartisan votes in both bodies, because this is common sense stabilization. Those of you who've been around for a while remember MSHA, which was dissolved under the Dayton administration. It was over $200 million a year in market stabilization. We're simply using the same tools that were in place prior to the ACA to put our market back in a position where our insurance providers can get their legs under them and Minnesotans can get some relief. We're not going to wait for Washington. We hope they sign our waiver. That is the plan. Secretary Price has indicated support. But this bickering back and forth is not getting us anywhere. We came in, we did the work we were going to do. We didn't take an adversarial role on this with Governor Dayton. We worked with his Commerce Department. Now we're going to work with Washington on the waiver, and that's the way we're going to approach health reform going forward. So I'll let you.
And I would just add to that as well. I think the fact that if you look at the governor's comments, he talked about the pioneering efforts the legislatures had made on this. I think that shows that he acknowledges that what we did was the right thing moving forward. I think those comments were very insightful, and I'm glad he made those remarks, and I think they're correct.
I'd like to key off on what the speaker said, that it's not a permanent solution. And I want to ask this question of all of you. Is this sustainable? $500 million of biennium for reinsurance, or is it not sustainable, say, beyond the current biennium as the governor is talking about? And I got another question to follow up.
I think not only is MNsure and Obamacare not sustainable for Minnesotans, but this isn't sustainable much longer in the future. This is something we had to do. We were forced to do. Minnesotans needed help. They were hurting. So we stepped up and provided some relief. This isn't a permanent solution. It's going to need some real reforms to turn the marketplace back around to where we see real rate reductions that Minnesotans can afford. And that's what we'll keep working on. I also will say that, Democrats' solution 5 or 7 years ago when this was passed was to look to Washington for answers. And today they want to sit with their hands in their pockets and look to Washington for solutions. We have chosen not to do that. We didn't think it was the right idea then. We don't think it's the right idea now. We had the best health insurance system in the country prior to Obamacare here in Minnesota, and I think we can get back there. We just need to cut some of the strings from Washington, D.C., not look to them for solutions, and put in place a Minnesota solution that, frankly, we know how to do already.
Next time, when we're here, when these estimates come out, or these preliminary rates come out, we're going to be in the middle of the campaign, right? And then right after that, you folks come back and start setting the state budget again. Can you tell Minnesotans that you won't have to use the reinsurance route in 2019? And if so, what things are you looking at to try to get this under control long term?
I hope that we don't. Unfortunately, if you look at the cost of what reinsurance, and the effect that it had in the marketplace, prior to reinsurance being in place, that impact was absorbed by Minnesota family budgets. Think about that. Democrats took year after year $500 million out of Minnesota family pockets, out of their budgets. And I don't think anybody is, talking about the fact that we put a freeze in place here that this really is going to help Minnesota families at least have some stability and some breathing room for a little while. The products are still, probably 2 or 3 times more expensive than they were prior to Obamacare. We need to get back to a place where Minnesotans can afford health insurance in Minnesota, and where health insurance actually covers health care, where they actually have real coverage, where they don't have to pay $50,000 out of pocket before they get 1 penny of benefit. To me, that's not health insurance. We've got a long ways to go, but Minnesotans have our commitment, just as we lived up to our commitment in today in passing this legislation that resulted in these rate reductions. They have our commitment that we're going to continue to work on their behalf to get rates back to where they should be and where they can be affordable. And it's going to take some real work, and we need their help to do it. This is not a partisan thing. It's going to take Republicans and Democrats to solve the problem.
How are you going to get there? I don't know, maybe you have some ideas, Mr. Speaker, or maybe Senator Benson, who studied this a lot.
The Senate has a select committee on healthcare cost, because one of the things we need to get to is the underlying cost of care. Our public programs, the governor's proposal, all depend on reimbursing healthcare professionals below market rates. And so instead of just forcing our hospitals to take less money, which is the governor's solution, we want to figure out how Minnesotans can be more in control of the cost of their care. And so Senator Jensen is leading that effort in the Senate. We'll work with our House colleagues. We're going to bring forward some ideas for Minnesotans to have more control, not just of their insurance, but of their care. And that's where we have to get to. As long as we keep focusing on the individual and their choice and their affordability, we're going to get there with bipartisan support.
These are preliminary rate proposals that could change over the next few months. One of the big things that could change, President Trump is threatening to end the cost-sharing reduction the federal government is paying out. And insurance companies say that that could drastically raise their costs and lead premiums to go up from these initial estimates. I'm wondering what your thoughts were on that possibility that action from the federal government could turn these rate reductions into rate increases.
I haven't done a deep dive into what is included in each of these rates, and so I'm not comfortable commenting on the impact of cost-sharing reductions. I've heard two versions. One is the assumption that there are no cost-sharing reductions, and the other is that they stay in place, and I can't tell you which products include those assumptions, and so I'm not going to comment any further.
Is it your understanding that with these proposals that every county would have at least one insurer?
It is my understanding that there is an insurer that's covering every county, at least one.